The challenge of police confronting someone in the midst of a full-blown mental illness episode was on stark display in Rochester, New York this summer when it was revealed that police killed a black man there and protests erupted for several days. This issue has been one that our colleagues at Rocky Mountain Public Television have been reporting in their own community. As John Ferrugia reports from Denver, law enforcement officers are often on the front lines of dealing with mental illness, and the criminal justice system is the path for access to treatment.
Dispatch, where was he last seen?
We get a call basically of a man with a weapon.
It happens thousands of times a year across Colorado and around the country. Police are called about a person in a mental health crisis who wants to harm themselves or others.
Hey, put your hands up. Put the weapon down. Don't move.
As Officer Richard Jones of the Pueblo, Colorado Police Department walks up, he sees the man turn toward him with a gun in hand. Jones has his own gun out and ready.
Put the weapon down. Put the weapon down. Put the weapon down.
Jones sees the man is wearing a sweatshirt, indicating he's a veteran. Immediately, Jones uses his crisis intervention training to try to find a hook, some way to connect.
I'm a vet. Drop the weapon. Drop the weapon. Drop the weapon. Dude, don't do it to another vet. Don't do it to me.
Shoot me.
I can't do that, man. I can't do that.
After nearly 11 minutes of having his gun leveled at the veteran, the tense standoff ends.
Just drop it. Just drop it. Okay, put your hands on your head for me.
At that moment, the relief of not having to shoot the man was overwhelming. After gathering himself as best he could, he went to the fellow vet and hugged him.
I'm going to tell you, I'm going to get you some help. We're going to start right now. I'm going to get you over here to Parkview, and we're going to get it taken care of, okay? Love you, bro. Good job, man. We deal with a lot of these cases, and we get a lot that have weapons with them. There's days that we're one after the other after the other. I mean,
This is normal.
this is normal. It is part of our job. But I can't do a burglary in progress because I'm doing one mental patient or party having a bad day after another.
And Jones, like so many other officers, is frustrated that his efforts seem to make little difference.
There's been numerous times that I've been finished. I've left this patient with the mental health counselor, left, gone to the station, finished my paperwork, come back out, and then patients walking down the street in front of me.
No place to put him.
No.
Jones' frustration with the lack of access to care and placing people on a 72-hour mental health hold only to see them getting little help is borne out by the numbers. In 2018, there were more than 33,000 mental health holds in Colorado, mostly executed by law enforcement. About 5,000 people were detained more than once.
There's no guarantee in our current safety net system that individuals will get served with the level of services they need.
Robert Worthwine is the director of Colorado's Office of Behavioral Health, tasked with overseeing the state's mental health system.
I'd like a model that doesn't require the law enforcement system to be an integral part of it.
Worthwine says the only way to break the cycle of jailing people with mental illness is to provide more and varied levels of services across the state.
There are a lot of people who need inpatient level care, but there are a lot of people who need community-based intense care. Sometimes it requires having a social worker drop in daily saying, did you take your meds today? Do you have bus tokens to get to where you need to get to? Sometimes it takes that much.
I would spend hours Googling on how to get help, where I could go, and I just couldn't find anything. They'd start, talking about insurance. I'm like, well, I don't have that. So what am I going to do?
It's 2713.
Kristen Lipsky works 2 jobs and has worked hard to overcome mental illness.
When I was 14, I did get admitted to a mental health hospital, and I was diagnosed with depression.
A year later, when she started drinking and smoking pot, things only got worse.
It was in the drug rehab that the counselor sexually assaulted me. After that happened, I would say I went on a downward spiral. I started using drugs I'd never used before.
Dispatch 144, I'm making an announcement.
It was a day 3.5 years ago she was coming down from a high. A day she threatened her mother with a knife. The deputies were called.
Sheriff's office! You're in the house! Make yourself known!
It is clear that both Kristen, whose paranoia was peaking, and the deputies armed with a taser and a gun were unsure of what was going to happen.
Are you a military?
I'm Weld County Sheriff's Office.
The deputies had no idea whether Kristen was armed. They just knew she was incoherent and saw the shotgun over the fireplace, and Kristen was moving closer to it.
Get your hand out of your pocket.
Finally, they tased her.
Stop! Stop!
She stabbed one officer with a knife she had in her pocket, but they finally subdued her without serious injury.
I just had a knife.
Yeah, that you used on me.
Because everybody rapes me.
Once in custody, Kristen was given mental health treatment and medication to stabilize her. She then spent 3 months in jail before posting bond to begin daily treatment. She pled guilty to a felony in the incident and was sentenced to 8 years in custody in a halfway house. Now she is getting the mental health treatment she couldn't get before being arrested. In fact, in Colorado, a primary gateway to mental health care is the criminal justice system.
You have to decide what your philosophy is going to be.
Boulder County, Colorado Sheriff Joe Pelley is a longtime proponent of providing mental health services in jail.
And if it's warehousing and security, this problem's never going to get solved.
Pelley says the jail population receiving mental health services has grown from 13% in 2002 when he first became sheriff to now, on certain days, 60%.
A lot of people would say, you know, you're not in the jail business anymore, you're in the mental health business.
Yes.
Commander Tim Oliveira, who heads the jail programs and support services, helps inmates get specific mental health services.
Jails are becoming these mental health institutions because people don't have anywhere else to go.
But in Boulder County, jail services are only the beginning. Once released, there are ongoing support services to ensure the person does not continue the cycle of mental health crisis leading to incarceration with no hope of success.
We've put the probation officer, mental health provider, community health, public health provider, and a case manager all under one roof so that they're not just leaving our jail without access to medication or without access to support.
The program is focused on offenders like Joe Dankowski.
A couple years ago, I was a mess. I was into drugs. I have a mental illness.
He has bipolar disorder and suffers from schizophrenia.
If you hadn't gone through the Boulder County Jail and gotten these services, where do you think you'd be now?
Dead.
We provide people structure.
Matt Jekyll is manager of the Boulder County PACE program. It serves more than 100 people annually.
Our entire team knows who you are. You see them daily. We build relationships.
Jekyll acknowledges that the upfront costs are expensive, but he contends treatment for patients like Dankowski versus jail is a bargain for taxpayers.
It costs more to put a person in jail and keep them there per day than it does to utilize our services.
But for most counties with far less funding, mental health programs in jails are simply not feasible. And that means those in need of service simply languish behind bars waiting, and often getting worse.
We have a safety net system, safety net being the behavioral health system that guarantees services, right? That doesn't guarantee services, and that's a problem.
The state's failing these people.
We can do more. We will do more.
Colorado's governor appointed a mental health task force to figure out how to reform the system and to pay for the services people need without relying on police. But the coronavirus crisis has now ravaged the state budget and plans for increasing mental health services. That means the daily struggle continues for both law enforcement and those who find themselves in a mental health crisis. For the PBS NewsHour, I'm John Ferrugia in Denver.
Thank you, John. And to note, that report was done before the pandemic.